Okay, so okay, so good afternoon, ladies and gentlemen. Good evening. I am Dr. Aisha Bianca Edwards Remy. I'm the head of clinical services here at AAR Hospital. We continue to have our webinar series, which is a weekly activity happening every Thursday evening from 7 p.m. Today, we'll be having a talk on common sports injuries, its management and prevention, or its prevention and management, by Dr. Paul Miano. He's one of our orthopedic surgeons. He was trained at University of Nairobi for both his undergraduate and master's degree. And then he did his fellowship in sports medicine in Italy at Gaetano Pini Institute. Dr. Miano, good evening. Welcome on board. And as soon as you're ready to start, we can proceed.
Yes, good evening, Aisha. Good evening, everyone. Thank you very much for the opportunity to have a series on sports injuries, because I think they've become quite common, and I think it's something that is of concern. Since COVID started, we're seeing more and more people who have started or joined the gym, or because of either watching their weight, they felt the need to do more sports activities. So we are getting to see more and more sports injuries, and I think this is a good series to just cover the common sports injuries that we get, how to identify them, how to prevent, and eventually how to manage. Yeah. So we are gonna go through the outline of this presentation. Is basically we will go through the sports injuries that are generally there, the common causes, and this will just be our outline on how people tend to either get the injuries, and more importantly, how to prevent, and subsequently, as I said, treatment and how we manage these sports related injuries. So by definition, what are sports injuries? So what I'd want to start saying is that every athlete is prone to getting a sport injury, irrespective of his fitness level. The type of injury that they get would depend on the nature of activities that they are participating in. And so there are different causes of sports injury. Most they can either be caused by accidents, so blunt traumas, where you get a blunt trauma, poor training. And in terms of poor training, they say if you're gonna engage in any sports activity, you need to first invest in the right gear. You want to invest the right equipment in terms of the shoe that you wear, the clothing that you wear, the protective gear that you're wearing. You need to choose the environment that you're intending to train on. If you're to start running today, you need to choose a track that is even, because I mean the common injuries occur because of you get people who are running in uneven grounds, and so on and so forth. Yeah. So in summary, it's, I mean, the causes can either be your poor training, poor equipment, lack of conditioning. You don't wake up just one morning and decide you're gonna run a 10-kilometer run. I mean, definitely you'll get injured. Yeah. And more importantly is warming up and stretching. I can't emphasize that more. For any athlete, and if anyone is intending to train to become a sportsman or to train, you need to, and I'll talk about this much later on in the lecture series on how to sufficiently warm up and stretch. Okay. Yeah. So injuries, sports injuries can be classified into soft tissue and bony. Okay. And the different soft tissue injuries can further be classified either acute or chronic. Yeah. And acute being a sudden traumatic event. Okay. And it normally or typically presents with pain, swelling of the affected area, and loss of function. If it is the knee, it presents with significant swelling on the knee, pain, and inability to use the limb. Yeah. And yeah, so it presents within the first 24 hours. Yeah. Chronic injuries occur because of repetitive cyclic activities, also known as overuse injuries. Okay. And this can either be caused by intrinsic factors, which are factors within. Okay. So, and this is caused by what? Again, as I said, lack of proper conditioning, or lack of proper training, lack of flexibility, immature cartilage, I mean, in the pediatric age group. Yeah. And then external factors, inadequate training equipment, inadequate clothing, inadequate gears, basically. I mean, the kind of shoes that you wear, the area that you're gonna try and work out or play, you should try and avoid uneven surfaces. If you're gonna run, try and run on a place, I mean, with even surfaces, because then you're more prone to getting either an injury on your ankle on an uneven ground. Okay. If you're gonna play football, uneven ground, again, you're more prone to getting injuries from that. Yeah. And then inadequate recovery. Yes, first as you train, you need to give your body time to rest. Okay. So in an event that you're getting this repetitive cyclic activities, okay, it causes micro injuries on your ligaments, and then that tends to give you a more chronic injury. So yeah, people will present with sudden onset of painful heel or pain around the Achilles tendon because of this. Yeah. Yeah. A different classification, we have soft tissue injuries being classified as either sprains or strains, and sprains being injuries to ligaments, and they're graded from grade 1 to 3. Okay, so first, second, and third degree. First degree being the mildest, and third degree being complete ligament tear. So you're getting an injury where you have your tendon being torn, and what are tendons? I mean, an attachment of ligament from bone to bone, okay? Strains. These are injuries on your musculotendinous junctions, okay? Or more so injuries on the muscles. Again, it's divided on based on the degree of the strain, from first to third being the most severe, okay? So first degree is a mild injury, third degree is complete rupture of the muscle with loss of function and obvious deformity, yeah? So these are just images depicting, I mean, what is a sprain, what is a strain, okay? The sprain is the ligamentous injury. I mean, an injury between, and you can see on the left side of the screen, a ligament attaches bone onto bone, okay? Strain is injuries to the muscle. So you can have injury on your Achilles tendon or the calf muscles, and as we said them, and as we graded them from first degree to third degree, okay? So yeah, different classification again for soft tissue injury. You can either have contusions, okay, which is a blunt injury or blunt trauma to a soft tissue part, and then you get bruising underneath, okay. It can also be classified either into abrasions or bruises. And abrasions is you have your skin cover is exposed, okay, or it's a penetrating injury. Bruises are more of closed injuries where you get bleeding underneath the soft tissue or underneath the skin, okay. So how they present, I mean, again, you'll have pain, stiffness, swelling. Ecchymosis is just the decaying of the skin. And maybe you have a hematoma, or I mean, blood underneath your subcutaneous tissue, okay. Yeah. So then yeah, so then you can get skeletal injuries, okay. So skeletal injuries from sports, okay. And this can either be divided into fractures, yeah, or dislocations, okay. And then now fractures can either be a closed fracture where the overlying skin is not exposed. Then you can have an open fracture. I mean, you have bone that is broken and it's exposed, okay. And then we're getting Salter-Harris, or what we call Salter-Harris is seen more in the pediatric population. This is an injury onto your growth plate, yeah, because the growth plate is a weak point, and I mean, the pediatric population are more prone to getting injuries around the growth plate area, okay, yeah. Dislocations, they are either divided into subluxation, which is not a complete, a complete dislocation, or the bone has not completely moved from a joint, okay, or a complete dislocation, which we either call it subluxation or now dislocation, yeah. And these dislocations and fractures best are treated, and managed initially. I mean, you should initially try and splint them at the site in an event you're at a training ground. Yeah. Then you need to refer to the next nearby health facility. The table that is up is a form of it's a form of it's a form of a quiz. Okay, so the red part is the injuries that you get. The blue part is how would you probably diagnose, and then the yellow part is the form of treatment. Okay, so I just run it through. Blisters, yeah, you'd get that through rubbing on the skin. Okay, fractures, you'd get that through an impact and that breaks bone. Concussions, again, in sports injuries, you really can't tell, or you can't limit ourselves only to soft tissue and bone, because then we also get to see patients who have gotten head injury secondary to sports, people who are playing rugby and all. Yeah. And then sprains, it's retching forces and tears on the ligament. And now, and in terms of management, it depends on so blisters you'd want to do clean, but do not burst the blister. Fractures you'd want to immobilize. Sprains, you want to do the RICE management, and I'll talk about that much later on. And concussions, definitely you want to take them to hospital. Yeah. So how do we prevent the injuries that we get? Number one, and the most important thing, is the technique that we use in terms of training. Okay, so you want to condition your muscles, condition your body. Yeah. Most injuries that we get to see are due to poor training techniques, poor conditioning. And if you don't know how to go through it, probably you can get help, get a trainer, someone who can advise on what you should do and to what limit that you should do on a particular day or on a particular week. Yeah. So technique is really important. And then your training. Yeah. If you're gonna train to prevent, again, as I said, to prevent injuries, you need to get the right equipment. If you're gonna run, get adequate footwear, get adequate clothing. I mean, choose your venue that you're intending to do this sport in. Okay, so you need to research a bit, and yeah, identify the things that would be triggers, then try and knock them off by doing some of this. They might seem petty, but they're really important. Okay. So yeah, so if you're gonna do start training today, the table that is that you're seeing is really important. Okay, because you need to condition your body. Okay, so you want to start with the warming up. Yeah, and a warm up should be at least 10 minutes. Okay. And warm up is what I mean. You want to do a slow walk, jog on the spot. Then you do your stretching. You want to stretch, and this will also really be important in terms of exercise. Yeah, and this helps to prevent most of the injuries that we can get or that people present with. Proper stretching. It's even more important to stretch well than even the exercise itself. Okay. Then your your active exercises, and then don't forget, after you've exercised, you need to warm down. Yeah. Again, that should take you about another 5 to 10 minutes, and then stretch and stretch some more. Stretching helps to prevent, as we said, our chronic micro injuries, yeah, which are long-term. So it's really important in terms of conditioning, as said, and in terms of exercising. Yeah. Additional tips, I'd encourage that drink enough water. I can't emphasize that more. Hydrate and hydrate and hydrate even more. Okay. If you're training in a warm environment, try and hydrate even more before the sport, during, and even after, to prevent a heat stroke. Nutrition, proper nutrition is important, okay? Because every time that you work out, you're burning energy, and you're burning energy, basically. So you need to replenish that into your body. So nutrition is also quite important, yeah? As I said, we need to get a trained coach, or yeah, a trainer for the people who are starting off. It will really help. If you're in a gym, you want to ensure that the equipment that you're using is well maintained. Okay, and this will just prevent injuries that could be avoided. So in terms of management, in an event you get an injury, so an acute injury, I don't, these 4 steps, the RISE management, is what would be used, or what I'd advise people to do immediately after an injury. 1 is rest. What does rest do? It helps to prevent further injury. If you got an ankle sprain, it prevents further injury. It reduces the blood flow to the area, so it further reduces the swelling that can occur. And this is really important. If you're gonna get an injury and you reduce, because the swelling happens within the next 48 hours, okay? If you can contain the swelling within the next 48 hours, this is really important even in future, because then your rehabilitation, which is really important afterwards, and for the professional athletes that would want to go back to their training, reducing your swelling helps in terms of return to your sport. Yeah. So it reduces your rehabilitation period. Yeah. Ice, which is I'd encourage, in an event you get an injury, use ice packs. What does that do? It reduces, it vasoconstricts the vessels. In an event it was an open injury, it reduces bleeding around the area, and it reduces leaking of fluid into the tissues. Yeah. It's important to be to note that, a lot of people say, I got an injury and I went and put a hot pack. Hot packs in the acute setup is not recommended, because hot packs cause vasodilation. It will increase your swelling at the injury site. It will increase the fluid leakage, and basically further worsen the condition, because then it increases the swelling around. The C is compression. In an event it's an open injury, you want to put a compressive bandage to prevent bleeding. If it's not, compression also helps to reduce, in terms of reduce your swelling and eventually now reduce the tissue leakage, the fluid leakage into the tissue, which subsequently would reduce the swelling. And then elevate, yeah? If you get an injury on your limb, try and put up your leg. If you get an injury in your hand, try and put an arm sling. It helps. It helps in the long run because, as again, it's a big cascade. It's a cascade where you get injury, fluid leaking out, swelling, pain, loss of function of that particular joint or limb, and the cascade, gets worse and worse and worse. Yeah, so if you can elevate, it's important. So the four, quite important in terms of management, and these are just basics that you can do at home. For anyone, it can be done. It can be done as you seek a medical attention. Yeah. 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 Thank you.
Thank you very much, Dr. Miano. So I'd want to ask Dr. Wambui maybe to unmute her mic as she co-moderates with me, and we'd want to open up to questions. So feel free to put your questions in the chat box or in the Q&A section. Any questions that you have of Dr. Miano. As we wait for the questions to start rolling in, I just want to check with Patricia. Patricia, I know that we are live on Facebook. Do you have any questions or comments on Facebook at this time?
Yes, I do have a question. What injuries do I use ice or heat for? What type of injury?
So let me say, for the acute injuries, you'd want to use ice because that reduces significantly your swelling. For the chronic injuries, yes, you can use your hot packs and heat therapy, and this has been used in physiotherapy and yeah, but acute, I'd advise use the ice packs. For the chronic ones, the hot packs would work. Yeah.
Okay, thank you. I don't have another question for now.
Thanks, Patricia. Wambui, do you want to take the question that has been placed in the Q&A section?
Yes, I can do that. Thank you, Dr. Miano, for the presentation. We have a question from Christine Maura, and her question is, how does one identify a concussion injury?
Thank you. So, concussion is basically it's a head injury. Okay. History of either blunt trauma to the head with a history of loss of consciousness. They might have.
Sorry, Doc, are you still there?
Yeah, can you hear me?
Yes, Doc, we can hear you. Wambui, I think it's on your side. Dr. Miano, yes, please proceed with the answer.
Yeah. So
yes.
Yeah. So history of blunt head injury. Yeah. And they present with either loss of consciousness, repeated headaches, or persistent headaches. They might have this projectile vomiting. If you present with probably convulsions, if you get to see anyone with that, after a history of blunt trauma to the head, that should be of concern. And probably they need to go to hospital and get checked up, because then yes, there's a risk of head injury there or concussion.
Thanks, Dr. Miano. So there's a question. It says, How do you explain the weekend warrior injuries, mainly ruptured Achilles tendons during sporting activities? Is it lack of pre-sport warm-up or aging?
Okay, so let me say, I think the weekend warrior, I think it is secondary to lack of warming up, lack of conditioning. Because, weekend warriors, the history is someone decided they woke up one morning and they'll run at a 42-kilometer run. Yeah. They will be they'll be prone to getting a rupture. You've not conditioned your body, you've not conditioned your muscles, you've not conditioned your ligaments, definitely you will get a rupture. Age can contribute if you have comorbidities, yes. Diabetes more so. People who are chronic smokers, there's a risk of that. But if you've done your conditioning well, then chances are you won't get a spontaneous rupture after a run. Yeah. So how do they get the ruptures? I think it's lack of well conditioning and lack of stretching well. Yeah.
Thank you, Dr. Terry. Mongwe, do you want to take the next question?
Yes, the next question is from Terry Barbara, and she's asking, what is the appropriate management for Osgood-Schlatter?
So Osgood-Schlatter is we call it an apophysitis of the patellar ligament insertion. Basically, it's pain around the knee, secondary to actually seen more in pediatrics, but more so is secondary to active sports that involve jumping, so your basketball, soccer. In the acute phase, in terms of management, again, as I said, rise. You want to rest, you want to ice compress, you want to ice, you want to compress, and elevate. In terms of if it gets chronic, then you would want to support, yeah, probably put a brace, put a splint, and then rest. I'd advise rest and rest some more, because the disease itself is due to active play. Yes. So the more you have the patellar ligament being pulled, the more pain around the knee joint. So yeah. So initially rise, then your splints, then rest. For people who have it chronically, and then I've seen the patients who have had Osgood-Schlatter managed chronically and it's not getting better, there's room for surgical intervention, but that is at the far end when everything else has failed.
Thank you so much, Doc. There's a question here for you from Mr. Chris Otieno. Does ACL reconstruction surgeries heal permanently?
So let me say, ACL injuries, do they heal permanently? I think they do. One, it depends on a lot of things. Age of the patient, are there associated comorbidities? Were there an associated fracture with the ACL ligament injury? Quite a number of things. Technique, surgeon's experience, all that can contribute to the healing process of an ACL. Do they heal completely? well, if done well, yes, they do heal completely.
So Dr. Miano, we are joined by Dr. Okumu, one of our other orthopedic surgeons. So Dr. Okumu, feel free to chip in as well with Dr. Miano as we answer the questions. As we wait for Dr. Okumu to settle, I just want to make a bit of an announcement. Please note that our orthopedic camp started today. It's ongoing until Saturday, which is the 26th of February, 9 a.m. to 5 p.m. We offer free consultation, free physiotherapy, free educational seminars, and much more. Dr. Okumu, can you hear us clearly?
Yes, I can hear you clearly.
Good afternoon. Thank you for joining, Dr. Miano. Dr. Wambui, what's the next question on board?
After what duration of time do athletes in high impact sports develop chronic traumatic encephalopathy?
Okay, maybe I could jump in there. The
Yes,
majority of athletes actually will never develop chronic traumatic encephalopathy. The athletes that are more likely to develop it are the ones who are involved in what we call high impact sports, such as rugby, American football, where there's a lot of contact. Yeah, and to answer your question, firstly, majority of athletes will not develop chronic traumatic encephalopathy, but for those who do, the age is not fixed. It can present as early as during their actual careers. And for some people, it can then present even 10 to 15 years after they have retired from the sport. So it's, to answer your question, it's firstly, it's not the majority of sports people who will develop it, but for those who do, the time frame is not clear. It can be anything from immediately during their career to even 10, 15 years after they retire.
Thank you so much, Dr. Okumu. So there's another question in the Q&A. It says, hello, I have been dealing with plantar fasciitis on my right foot for about 8 months now, and there is no improvement. I have used all the remedies I'm aware of, example, physiotherapy, ice water rolling, massage, exercise, etc. I have done a lot of research online and on YouTube, but I'm still in pain. What would you advise? And this is Christine asking this question. Dr. Miano, Dr. Okumu?
So let me go first. Maybe Dr. Okumu will give your opinion a bit later. I think plantar fasciitis, I mean, heel pain, would be caused by a lot of things. So first, what are the daily living activities that Christine is involved in? Yes. Does she stand for long hours? Does she walk for long hours? What is the kind of shoe that she wears? Because heel pain has been related closely to the type of shoe that you wear, your activities of daily living, and yeah. So if she's been on medication, again, as I said, I'd say we go through the conservative first, okay, and exhaust that before thinking of any surgical intervention. I don't know what, Dr. Kumu, maybe you'd give something different, an opinion different.
I think what you said.
Dr. Kumu comes online. Christine, I'll say that you should come to the AR Hospital Orthopedic Camp, which is ongoing, where you can see Dr. Kumu tomorrow. But Dr. Kumu, I know you have a more detailed answer as I promote the orthopedic camp.
Okay, what Dr. Miano has said is actually, to start with, fairly correct, that heel pain can be caused by various things. So to answer Christine's question is, first of all, as where did she get the diagnosis of plantar fasciitis? If she got it on YouTube or Google, I'm sorry, then the answer to your question might be that it's not plantar fasciitis at all. So the question then is, did she see a medical professional? Did she get this diagnosis from after being evaluated? Once you've gone through the conservative steps for treating plantar fasciitis, then there are additional options like steroid injections, injection of other substances such as PRP, and even at the very end of the scale, if these interventions are not working, there is an option for surgical intervention. But these are as a last resort. So maybe the beginning point might be to be assessed, even if you've had it before by a medical professional, and then have the advice tailored to your treatment. I am a fan of YouTube and Google, but I honestly would not recommend them to be your source of medical information definitively. Thank you.
So thank you, Dr. Miano and Dr. Kumo. Dr. Wambui, are there any more questions that you can see in the Q&A? But as we wait on you, Patricia, on Facebook, do we have any questions, feedbacks, or comment?
I'm seeing on the Q&A there's a question. I don't know if it's been addressed. Ever heard of pain experienced on one knee only when running downhill or descending a hill? As the terrain level, it goes away. Remedy? I don't know if we've touched on that, no?
No, we have not.
Yeah.
So we turn that over to the surgeons.
Okay.
Would you like the question repeated, Dr. Ray?
Yes, please.
The question is, ever heard of pain experienced on one knee only when running downhill or descending a hill? As the terrain levels, it goes away. Remedy?
Okay. So let me say around the knee, there are quite a number of structures that could cause pain around the knee. Classical of what causes pain when you go up or down a hill would be a meniscus tear, but I wouldn't say that they have a meniscus tear, because then again, we've not done a clinical examination. We've not had the symptoms per se and a good clinical examination. But yes, if you have pain when you're going down the hill, probably there's something irritating your knee. Yeah. Top on the list would be a meniscus tear. You can also have loose bodies in the joint that can irritate. And then there are people who have something we call fat pad syndrome, where the patella tendon, the fat pad beneath that irritates. So it could be quite a number of things. What I'd advise is probably they need to come in. We just have a good consultation, history taking, and then a physical exam. Then we would decide what in terms of management, how would we go about it?
Dr. Kumu, what are your thoughts?
I think I fully agree with Dr. Miano that probably the best course of action would be to assess the knee and then take it from there in terms of even imaging to see what specific problem is there. But knee pain, which you've experienced going up and downstairs, could be anything from what he's mentioned, a meniscal injury, to even the signs of arthritis in the early stages. It really depends on the nature of the patient we are dealing with. So probably the best advice would be, again, to come in and let us take a look at the knee and give you the appropriate advice for that specific patient.
Thank you very much to both of you. Dr. Wambui, do we have any questions in the chat?
Yes, there's a question from Nicole Maranga. And the question is, what would be the cause of losing balance from the knee area all of a sudden with no pain? And this is for someone who's a swimmer.
So maybe I'd give my thoughts, yeah? So Nicole is a swimmer, so probably involved in active sports, yeah? I don't know, is there probably a history of injury to the knee prior to that? Are there any other associated conditions? Again, as I said, I think a physical examination would really help because if she's losing balance, chances are there's something that is going on around her knees, and a physical examination would really assist. I don't know, maybe Dr. Kum would have something different.
Dr. Aisha, today's questions are really tough. Most of these patients would like us to give them definitive answers when it's really not possible in this type of forum. Again, just loss of balance with the knee, most likely would suggest some sort of instability in the knee. And this could be caused by such a large range of things, right from, like we mentioned, an injury to, again, for example, if you were to ask about the typical symptoms of knee osteoarthritis, one of them is just a sudden loss of balance while walking. So the nature of this problem really depends on the type of patient we're dealing with. Is this patient young? Is this patient older? Is there a history of injury or not? Have they experienced this instability over a long period of time? So I think to answer that question definitively might be difficult. And that's why you hear us going back to the advice we're giving, that each patient needs to be assessed specifically so that we can then be able to give a clearer answer to their problem.
Thanks, Dr. Ari. So what I like about today's questions is that it actually has the surgeons a little bit uncomfortable. I think anyone who knows surgeons, you guys usually, you're very comfortable, you're very straightforward. This is what it is, this is the management. And I think the thing that I take away from this is, for all fields of medicine, and orthopedics is no different, diagnosis is really back to the basic history and examination. So you're getting a bit of the history and you want a full history and a proper examination in order to make a diagnosis and therefore come up with a treatment plan. Am I correct?
Yes, Aisha, I think that's correct.
Okay, so let me make you a little bit more uncomfortable. Let me make you a little bit more uncomfortable. Someone says, all joints in my body crack from the pinky toe up to my neck, elbows back to waist, plus knee joint pain, one hip joint pain. It's shocking. What can I do? And I promise that question is not from me. So all joints in my body crack from the pinky toe up to the neck, elbow back to waist, plus knee joint pain, one hip joint pain. I'm not sure if it's on the same side. It's shocking. What can I do? Dr. Miano, I think that one is for you.
Oh my, Aisha.
The question is not mine, I promise. I wish the person would not have put themselves as anonymous, but yeah. I love the question.
Okay, so again, how old is the patient? When did the symptoms start? what are they aggravated with? I mean, do they get this joint cracking like on a daily basis, like on an hourly basis? And then again, as a physical exam would really help. Then we would need to go in for investigations, probably an X-ray, probably do some lab investigations to rule out rheumatoid arthritis, to rule out any other inflammatory arthritic changes that would cause crackling sound and painful joints. Yeah. So yeah.
Okay, Dr. Miano, let me ask an easier question.
Yeah.
I mean, I'm loving the
if I could
question.
if I could jump in a bit and say,
please, jump in.
Cracking of the joints, I don't think is an issue. If it was, probably my grandparents, my mom we should consider them very unwell. The issue that the client should really focus on is the pain, and pain is something they should take seriously. And again, we'd advise them to get reviewed by a medical professional.
Thanks, Dr. Okumu. Then, Dr. Okumu, you can take this question. It says, what are common shoulder injuries and what to do when the joint comes out of the socket and pain from time to time? I'm unable to raise hand freely. So what are common shoulder injuries? And then I guess if you have a dislocation from time to time and you're unable to raise the hand freely, what do you do?
So I'll address the dislocation issue first. This client seems to have a recurrent shoulder dislocation, which is, I think, a serious issue that really needs to be addressed, and more likely than not from a surgical way, because it means that the shoulder is unstable. So ideally, this client should have an MRI done to determine what type of instability is there. And there is instability, yes, that cannot be managed surgically, but on most occasions it can be. Common shoulder injuries include just sprains or strains to the ligaments. You can also have what we call tendinitis or tendinosis, depending on the age of the patient, which is literally irritation or inflammation of tendons around the joint. And tendinosis, when you talk about tendinosis, we are already referring to tendons that have some change, some degenerative change. Eventually, this leads to tears in the muscle tendons, especially of the muscles we call the rotator cuff, which is a fairly common injury in people around the age of 40, and also in young athletes, especially those ones who have a heavy throwing motion. For example, baseball players, people who play cricket, and sports like that. So maybe those are the things I would mention are common. So commonly, for athletes, they will strain or sprain their ligaments and tendons. Sometimes they can also get irritation, what is referred to as tendinitis. As you grow older, those changes can become a tendinosis, which is degenerative changes in the tendon. And lastly, that can end up in a tear of the muscle, especially of what we call the rotator cuff.
Thank you so much, Doc. Dr. Ombui, on your side, are you seeing any questions? Patricia, we'll come to you after.
Maybe just.
Sorry, Doc.
Yes,
Sorry.
Dr. Miano, please jump in.
So maybe just to add to what Dr. Okumu was saying, in terms of, we have this patient who the joint comes out of the socket and pains. Again, as maybe a history, was there a history of trauma prior to this? And as we even saying, that this is a person who has recurrent dislocations, we also need to remember that there are people who have hyperlaxity syndromes, and these are just hereditary or genetic conditions, and you do an MRI on them, and everything looks fine. So I mean, not need to forget about that. Yeah. So still, clinical exam, thorough history would really help a lot. Yeah.
Thank you so much. As Dr. Wambui gets her question, let me put in a question. So the question is, or maybe it's just seeking advice. A lot of times patients or families or friends, they're injured, and before they see an orthopedic surgeon or a doctor, they go to a physiotherapist or chiropractor. What is your take on that? Either one of you.
I think my 2 cents would be that it's a rather strange way of addressing a problem, because ideally you want to know what is wrong before then you seek the treatment. As far as I'm aware, physiotherapists and chiropractors are individuals who are professionals, yes, but typically would work under the supervision of an orthopedic surgeon. So I think the priority would be to see the orthopedic surgeon first, and then get direction on what type of treatment would be appropriate, including sometimes seeing a physiotherapist and occasionally a chiropractor. The other thing to note for us when we talk about chiropractors is that we are not entirely sure of their methods and how scientific is, if that would be the correct word to say, their methods are. There are many clients who say, yes, I saw the chiropractor and I experienced significant improvement, but I always put a rider on that you see the chiropractor at your own risk, and there's also a very likely chance that you could get worse after seeing a chiropractor. And there are many situations we have seen. So probably let's maybe put the donkey before the cart, see the doctor first. Then if the doctor directs you, you can go and see a physiotherapist or a chiropractor.
Thanks, Dr. Harris. So Dr. Google will not work in this case. I understand. I think all patients who are logged in, as well even as our healthcare practitioners, can relate. It's so easy to Google the management of anything now, and at least, start the process as you go to see the doctor. Dr. Wambui, what is the next question on your side? Or I actually should ask, is there a question on your side? Dr. Wambui?
Yes, there's a question. How frequent are heel sac and Bankart lesions in high impact sports?
Maybe I can take that. So you tend to get heel sac and Bankart lesions from shoulder dislocations, okay? And Bankart lesions would be tearing off of the humeral labrum, the glenoid labrum of the glenoid, okay, which should be either a soft tissue or a bony Bankart. How often do we get to see it? It's not that common, but most of the people who have anterior shoulder dislocations would tend to have a Bankart lesion plus a heel sac lesion. Yeah.
Thanks, Dr. Harry. Dr. Wambui, I think there's one.
Dr. Miano, maybe would that be in the setting of chronic instability, like the patient who is now talking of a recurrent dislocation?
Yeah. I mean, and then again, there are people who also, I mean, first time dislocate, people who have dislocated only one incident, and they have this huge heel sacs lesion on the humeral head, and then they say they've never dislocated again. So you do your MRIs, they have the heel sac lesion, but then they've never dislocated again. So yes, people who have these repetitive dislocations, most of them will have a Bankert lesion and a heel sacs lesion. But the reverse is also not very true, because there are people who have Bankert and they've never dislocated again. So yeah.
It's actually something I find interesting, where you're having an MRI when you don't have, if you've just dislocated once, what is, it might be one instance where you actually don't need an MRI at all.
Yeah.
Thanks, Dr. Okumu, for that insight, and thank you, Dr. Miano. I think we have one last question. We've gone a bit over as it's 8:04 p.m. So, Dr. Wambui, can you just ask the last question, and then we start our wrap up, so that we stick true to our values of being timely in terms of keeping starting on time and ending on time.
So our last question: spontaneous tendon rupture has been associated with fluoroquinolone therapy. Are there any cases that any of you have come across that are initially presented as sports injury? Should I repeat the question?
I think so.
Spontaneous tendon rupture has been associated with fluoroquinolone therapy. Are there any cases any of you may have come across that initially presented as a sports injury?
I've actually never seen one that was directly related to fluoroquinolone use. It's something that's documented in the textbooks, but I actually have not seen one personally.
Let me say, I equally have not seen one myself, but I mean, yes, as you said, it's been documented, and even the documentation is, the population is quite low. I've not seen one. Yeah. But then yes, there is a risk of probably a 0.1 or 0.2% risk of getting tendon rupture with a history of fluoroquinolone use. Yes. Yeah.
So I'm not an orthopedic surgeon, but I saw one during my time in internship. So guys, I think I'm doing a little bit better than you guys in terms of this one. But seriously, we are now at 8:05 p.m. Today is our last webinar within the orthopedic series. We will continue our weekly webinar come next week, Thursday, moving into another series. We'd like to thank Dr. Miano for taking time to do this presentation today, and Dr. Okumu for joining in during the Q&A session. On behalf of the senior management team of Air Hospital, we thank you guys for taking time to always log in and just be informed and ask us questions and challenge our doctors in terms of just making sure that we're on point with our knowledge set. We'd like to invite you guys to our free orthopedic camp, which is ongoing. It started today. It goes until Saturday, 26, 9 a.m. to 5 p.m. It's free consultation, free physiotherapy, educational seminars, and much more. We look forward to seeing you there. On Saturday, the 26th, we also have our Equip Your Nanny and Caregiver training. It's a first aid course training for caregivers and nannies. It happens at the hospital at a cost of 2,800 Kenyan shillings from 10 a.m. to 4 p.m. It is a certified course. You will be taught by trained doctors and nurses who have been equipped to provide this training. As we wrap up, we are aware that we have a bit of a lag for our community on Facebook. So we'll take our time to log off so that it's not an abrupt closure. So if you have any questions, please feel free to raise your hand and ask any questions as we move to the unofficial part of the webinar. So thank you very much for joining us. Thank you, Dr. Okumu. Thank you, Dr. Miano. Have a good evening, everyone. For the intent of this webinar, it is over, but anyone who has questions can ask as we wait to log off. So I guess, Dr. Kumu, as we chat, and Dr. Miano, there was the question that you guys were asking how old the patient is, and I'm seeing that the patient said that they were about 20 years old. Do you remember that question?
Yes,
Yeah.
I am. Yeah.
So 20 years old, normal
Sad.
falling as a child, 20 years old now, majority of their lifetime, they've been having the problem. I don't know if that influences your response and what you thought.
Okay, on my end, maybe not. I still think I'd need to do a physical examination. Yeah, I don't know.
Okay.
Maybe Dr. Okumu would have a different view.